CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.
Hi everyone, welcome to CollabTalk, a new talk series by Collaborative ABA Services that provides information and resources about autism and everything in between. I'm Alicia, I'm the founder of Collaborative ABA Services. I'm here with some of our amazing team members. Team?
My name is Katie, I'm an occupational therapist and a certified feeding specialist.
I'm Bree, I'm a BCBA.
I'm Meg, I'm a licensed social worker and registered behavior technician.
So today, we're going to talk about a topic that may be familiar to a lot of families with a child on the spectrum or who work with children on the spectrum. And the topic today is going to be about feeding challenges in autism. So we do know that children with autism can also present with feeding challenges, which can make those routine meal times very challenging. And as a parent or caregiver, meal times can kind of become very frustrating as you're trying to navigate your child eating, even if it may not be the most nutritious food choices. So in this episode, we're going to discuss some common feeding challenges and also ways that we can help. So I want to make my disclaimer, so please note that this episode is not intended to critique or endorse any specific providers. Our goal is to simply educate and empower the community by providing information and resources, understanding and supporting children with feeding difficulties. So team, let's dive right into this topic. So, when we're talking about feeding difficulties, what are some risks that you guys see for having some feeding challenges in children?
I think one of the biggest things is that what's really common with children with autism is picky eating. And once you're a picky eater, if you're avoiding certain food groups or if you're avoiding certain types of foods, you can have really kind of nutritional deficits. You can have weight and growth concerns. You can have a lot of host of difficulties if you think you're missing certain food groups.
Yeah. And I think then that kind of brings about a whole nother issue of like, as a parent, you're then stressed and it puts on more pressure onto trying to get that child to eat that specific food group if they're missing that nutritional value. And I think that becomes a whole nother level of concern.
And I think too, also it brings some family stress, right?
Oh, yeah.
Because now meal times have become more aversive or challenging. And then we also think about social challenges. So if the family is having a birthday party or some type of social gathering at a restaurant, now you have to worry about, how is my child going to respond if they don't eat the foods that are, provided at the restaurant?
Yeah, a lot of families I worked with mentioned that. They mentioned that, I've never been to a restaurant with my kid because my kid doesn't eat anything at a restaurant, or I'm really, nervous about going on vacation because they're not going to have the foods that my child typically eats.
Right.
So it can, and you mentioned, Brie, about parents. It's they get really stressed out. It's frustrating when you can't get your kid to eat food.
Yeah. And it's also scary, right? If you have that concern of nutritional deficiencies, you then become scared about something else as a parent.
Right. And good points. So next area, let's kind of discuss why feeding challenges occur in autism. And I know that is a question for parents, caregivers, and even some providers. Why does this happen with children on the spectrum? And we know, Katie, you were mentioning that, there's those sensory challenges, right?
Yeah, sensory is a big piece of it. And I think a lot of kids with autism really struggle with textures, flavors. Sometimes they can have a really difficult time with how food is presented, the way it looks. And so I think that those sensory things promote a big challenge, and then that can even roll into oral motor difficulties, right? So if you're a little kid who's only eating, crackers or those easy, crunchy things, maybe softer things like chicken nuggets, you're not spending a lot of time eating things that require a lot of chewing, that require a lot of those higher level oral motor skills. So then you can end up having challenges a weaker jaw or difficulty moving things around.
I think some of it too that we see in the ABA behavioral world is that behavioral rigidity. They get in that routine of, I have this specific drink in this specific cup and it has to be in this specific cup or I don't drink it. And then, you kind of get in that vicious cycle of I want my child to drink whatever it is, so I'll give it to them in that specific cup. It becomes even more rigid because you can't get out of that cycle.
Right. And how food is presented too, grilled cheese.
Right.
Is it cut in triangles? Is it cut in half? Is it cut in squares? Does it, to the child, it doesn't taste the same if it's a different shape, even though it's the exact same food.
Right.
Something I've done personally in the past is kind of shaping that, and then, when they only eat grilled cheese, and then trying, the cheese quesadilla, but cut it in the triangles. And, kind of shaping it and to kind of broaden the repertoire.
Right.
That kind of sameness, but with flexibility.
Yeah.
And I think another important point is, some of the children on the spectrum do have those, deficits or limitations in communication. So like being unable to, express their wants, right? And telling us what they want can become frustrating for them. And also like they can't tell us with, the deficits in communication, it might be something medical where they might have some gastrointestinal, discomfort, and they just can't tell us like the reason. And it's kind of like we're playing detective and trying to figure out, okay, what's going on here?
Right.
So those are some other key pieces too. So, now let's kind of talk about like some common feeding challenges that we see in individuals with autism or children with autism.
Yeah, I think kind of like I mentioned before, like the picky eating is one of the biggest things. So picky eating is kind of like, it's a term that's thrown around a lot, but it kind of means a child who is avoidant of certain types of foods or a child who is avoidant of certain food groups. I think one of the biggest things that I see is that children really struggle with things that are kind of a mixed texture, a novel texture. So you might think, oh, like soups and casseroles, that's mixed texture, but even a sandwich is a mixed texture. So I have kids that will just eat crackers, or they'll just eat a PB&J, but then if you put peanut butter on the cracker, it's like, nope, I'm good. Like that's a different texture. So that can be really challenging for kids, and kids can also have difficulties with fresh fruits and vegetables because they're juicy and they're crunchy or they're cold or it's different. And I want something that's very consistent. And I think that kind of leads into what you mentioned about like not the healthiest things. A lot of children with food sensitivities love fast food because it's the same every time. I love my food from my package because it tastes the same, it looks the same. That kind of like mass-produced consistency is really kind of comforting for them and soothing because I know what it's going to taste like. It's not going to be different, but if you make me chicken nuggets at home, that might be different than the McDonald's chicken nuggets, and I don't, my emotional feelings or my comfort with that is going to be different, and that's really hard.
Yeah, like the presentation, like you were saying, kind of mixing up the presentation, like if they always eat on this one blue plate, when they go to school and that plate's not available, are they going to eat in the community if they don't have their blue plate? So kind of what, like how it's presented, like where they sit at the table, all of those things, kind of trying to create flexibility so it's generalized in other settings.
And also too, I think because of that rigidity, right, and they have to have things a certain way, trying new food can, present some anxiety. And then with anxiety, we might see some behaviors, right? And then that's where the issues with feeding come into hand, because now we have a kid that's not only selective with eating, now we're also getting behaviors during meal times.
Yeah, and we've talked about it in previous episodes, but kids with autism have challenges with emotional regulation. So I have a lot of kids that cry when they see new foods or they see a novel texture and they start to gag. Like they have a lot of big feelings and emotions surrounding that, and it can make not only mealtime stressful, but sometimes very scary and anxiety producing for them.
And also, like, in regarding, or in addition to, like, what we talked about, picky eating and food selectivity, you start talking, too, a lot about, like, those sensory sensitivities and challenges. Can you kind of talk more about that?
Yeah, so we kind of talked about in previous episodes that children with autism are more sensitive to certain things. So a lot of kids can have difficulties with the way that things taste, the way that things feel in their mouth. They can have difficulties with how things smell. They can have difficulties with, the sounds and foods that, the sounds that foods make. So I have some kids that I work with that they can't sit at the table and be around other people eating, whether it's, the utensil scraping on the plate or people chewing, and they will, take a bite and then they'll kind of boogie. So they'll, have a snack and then they'll kind of, walk around, and then when they're ready, they'll come back and they'll have another snack. So even just sitting at the table with the food in my space, smelling things and seeing things, even that can be overwhelming. So it's not just what does it taste like, it's what is eating in general as a whole kind of thing is really challenging.
I've never thought about that.
Yeah,
that's a
and
good
then
point.
When kids also have ADHD, kind of the environmental distractants going on around them. Like when you're used to sitting alone at the table and quiet at home, and then you go to school and it's this robust cafeteria and
it's loud,
and you don't always sit in the same place, and it's loud and there's different people and all of those things.
Yeah, we have a kid here at the clinic that he has some picky eating challenges, and I can see when he sits down to meals, even with just 5 or 6 of his peers, he's like, "Ooh, what's going on? Anything but what I'm supposed to be eating? What do you have? What's happening?"
So true.
That is true. Good point. Next area, let's kind of talk about oral motor difficulties, right? So that kind of goes into like what the difficulties, like the chewing and the swallowing.
Yeah, it does. I think for oral motor, if you think about kind of similar, we've talked about other kind of skills, you develop those skills by being exposed to certain things. So if you are only eating certain textures that require you, it's called like a munch, like you think crackers or things that are pretty easy, or, yogurt or some of those like fruit pouches where you don't really need to chew. You don't develop those oral motor skills because you're not exposed to it. So then you have kids that are 5, 6, 7 years old that don't eat a lot of those like things that like fresh meats and vegetables that require a lot of that chewing. So then they can have difficulty with chewing and swallowing. They can have gagging because they're trying to swallow, say, a whole gummy before they chew it.
Right.
Or they have difficulty managing the food, so they're drooling or they're pocketing it, like between, where your cheek and your teeth are in the back. Kids will kind of stick food in there if they're not sure what to do with it. And then if you think about the communication challenges and the emotional challenges and the sensory challenges, you present a food that kids like, I don't know how to eat this. I don't know what this is going to be like. I'm just not going to do that.
Right,
I'll just pass. Thank you.
Right. And another thing to also consider is like with autism too, there's that rigidity, right? So those rigid mealtime behaviors, and that can also present a challenge. And I think we talked a little bit about it at the beginning, right? Where, the food has to be a certain way. So like that insistence on the same foods, routines, even it could be down to the same utensils. Like there might be a kiddo that has to have a pink fork, or the fork has to be a certain place on the table. Could be huge, or they have to sit in a certain place at the table, and if they don't sit at that certain place, then they're going to be thrown off.
Yeah, and I think that those behaviors kind of get reinforced. You mentioned as a parent being stressed out. I've had many parents I've worked with who've mentioned they feel like a short order chef because they cook, food for their partner, and then they might cook a different meal or a different food for the other children in the family, and then they're cooking that one thing for their child. And because they know that their child will eat this, like if I put, the cheese quesadilla with the triangles cut on this blue plate, they're going to eat it, and that's not stressful for me. I know my child is fed. They're not going to bed hungry. I'm going to do that no matter what. And then so just by default, it sort of reinforces some of that rigidity because it just becomes a easier thing for the family to do. It's hard. It's
a vicious cycle. I can attest that I get into it with my own toddlers. Like it's hard because you're like, but then they're gonna be hungry, so I need the meat. So here, just have this and eat. But always consult with your pediatrician. If your child's fine nutritionally, then usually you can take a step to push a little bit further and kind of get through that rigidity by adapting them to be a little bit more accepting to maybe one of the rigid routines.
Yeah, and like introducing new foods, like they're absolutely not going to eat, a whole pile of blueberries. Maybe just put one on their plate and tolerate it just being there. Not touching it, not eating it, not even looking at it. It's just there.
It's there.
So like one step at a time.
Right. And they can still have the pink fork. Let them have their chair, the pink fork, and one blueberry.
Minimal changes. Little tiny changes.
Little by little.
Right. And another thing to consider too, right, is the medical difficulties. I know I was talking about that earlier about the limitations in communication. They can't always tell us what's going on, and how like there might be some gastrointestinal discomfort, right? Because we really don't know, because there's some kids that just can't communicate that how they're feeling. Like
a history of reflux, if you think about like, when you've had really bad heartburn, now imagine having that all the time with anytime you eat, like as a young child, that's really stressful and uncomfortable. And if you can't communicate that, eating is not fun. Like, maybe they have, gluten sensitivities and they eat something and their stomach feels really funny and they're like, oh, this is not fun. I'm not associating food with, comfort or being an enjoyable experience. So that can make it hard. So if your child is avoiding certain food groups or certain textures and you are, concerned, ask your pediatrician about it. There are definitely very non-invasive ways to test some of these sensitivities now.
Good point. So after learning all this information, how can parents or caregivers help a child who struggles with feeding difficulties? So I know the first approach we always say is collaborative or team-based approach, right? And we're really big on that, and I believe we talked about that in other episodes as well.
Yeah, I think that it's like we were just talking about this, like it's not just one thing. It's never just a sensory thing for OT. It's never just a behavior. It's never just a parenting thing. It's all kind of blended together. So I think having a team that has a little piece of everything is really important, because I know when I've worked with kids for like, the sensory or OT side of feeding, we've gotten to a point where it's like, okay, I've done, the blueberry's been on the plate, I've done, you've licked the blueberry, I've done, you've smelled the blueberry, but now you're just refusing to eat the blueberry just because you don't want to. So then we get to a point of, okay, how can I collaborate with the behavioral side to get like, kind of some more kind of engagement in that? Because I know that we've really worked the sensory piece and we've worked the parenting piece, but we now just got to work on the rigidity piece.
Right. And I think making sure too that there isn't another underlying medical problem, right, or issue. So if there is a feeding or chewing or swallowing, making sure that those are ruled out or those are addressed before kind of going to the behavioral side, or maybe even like doing it at the same time as sensory and behavioral.
And like Alicia said, like not to kind of condone or talk about different approaches, but in terms of just helping families understand that a feeding specialist from like the OT and speech side of things can be either of us. OT really does work on more of the sensory and kind of the exposure and the emotion surrounding feeding. But if your child does have a, diagnosable or, a definitive like swallowing or like, oral motor deficit, a speech and language pathologist really is the best place to go for those kind of supports.
And I think another important team member to consider too is a dietitian, right?
Yeah.
Because they also, help with monitoring nutritional intake, and then they also can make some recommendations in regards to like supplements if needed.
Yes.
Because we also want to make sure that they are getting a balanced, healthy diet as part of the team as well. So in addition to, a team approach, what are some goals of feeding therapy?
I mean, it should definitely be personalized. Like, as we have all just said, like, it really depends on the child or the individual of what their needs are, whether it be a swallowing or chewing, or is it sensory, or is it behavioral. So it kind of, again, it has to be individualized.
Right.
Yeah.
Expanding like that repertoire of food and varieties of food, so that going out in the community and school isn't difficult and helps with the behaviors that come along with those frustrations.
Yeah.
And I also think like we want to reduce the anxiety and stress at mealtime. So we want to make mealtime as pleasant as possible for not only the parents or caregivers, but also for the child.
Yes.
Yeah, and I think kind of addressing like what is the biggest barrier for the child. So that's the unique piece you mentioned. Like some kids I work with, they're so anxious that like even just thinking about like tasting or trying a new food is so far beyond where they're at. But just being at the table really is the first step. So I think kind of identifying like, does my child really need to work on their feelings surrounding mealtime? Does my child really need to work on, okay, I eat apples, but that's the only fruit I eat. Okay, or maybe there's some other types of things. So really talking to your provider about what's really important for you, I think is helpful. Because sometimes families will come in and it's like, I just want my child to eat. And I was like, that's absolutely the goal. We all want your child to eat, but there might be other things that come before just putting that food in their mouth.
Right.
And team, what are some additional tips for families or caregivers that are watching this episode today?
Try as hard as it is as a parent to take some of that pressure off. Like sometimes, of course, like with any typical child, like, giving that stress, or they feel that stress of like, you need to sit down and eat, you need to sit down and eat. And then they're like, I'm not sitting down and eating.
Nope.
So like trying to keep the stress a little bit low as much as possible.
Right.
And I think seeing progress with food, not just as eating, but their engagement with it. So if your child's able to sit, at the table, maybe with a toy, maybe they're not eating, but they're sitting through a family mealtime. Maybe you can go out to a restaurant and your child's able to just be at the table while you're there. If your child's able to do kind of like messy play with food, maybe you paint with pudding, maybe they use cookie cutters to help you make cookies. Like those kind of engagements with food that are not solely focused on eating are still huge, improvements for kids.
Right, like graduated exposure sort of in a way.
Right. And I think meeting the child where they're at, right? Maybe you don't want your child to be sitting with a tablet in front of them or with toys at the table, but meeting them where they're at. So maybe if you're trying to increase how long they're sitting at the table, it's maybe okay for a little while if they're having the tablet, and we can slowly fade that away, or the toy. Meeting them where they are, and we will eventually get to the end goal of maybe sitting for the whole mealtime without a device or toy.
And I think having realistic expectations too about foods. Like I joke with parents, like if I could just eat candy and cake and like sugar, I would. Like I like vegetables, but like they're not my favorite thing to eat. But I know that like if I just ate lollipops all day, I'd feel like crumbs. Like I wouldn't feel good. So I think kind of understanding that your child may not naturally gravitate towards those healthier foods, and that's okay. But helping them to understand that yes, I know that this might not be your favorite thing, but it's important for us to eat it to be healthy, And then once you're done with that, then we can have, maybe something you really enjoy. So it's not always like, okay, my child doesn't love eating all those things. Well, that's okay. I don't love eating everything. But just finding a balance so that they can have that nutritional or healthy support.
And I think, consulting, your pediatrician or professionals early for guidance is key. Like if you're noticing that this is an issue, definitely reaching out to your pediatrician early, so that way we can kind of address it early on, as opposed to waiting until they get older and it's like, oh no, like we have a bigger issue.
Right.
Also, we want to make sure that we're introducing foods very slowly, but also consistently. And every little bit of progress is still a win.
Yeah.
So that is one thing to consider. Like even if they're even kind of like what Meg was saying earlier about like tolerating the food being on the plate. Even if they can tolerate the food being on the plate, that's still a win.
Absolutely. Absolutely.
And you're not alone in this kind of journey. There's so many families, whether it's neurotypical or, children on the spectrum that are struggling with picky eating. So if you go onto Instagram, TikTok, I don't know if Pinterest is still a thing, but like those places, there's so many ideas on what to do. There are books and podcasts and lots of different things. So you can kind of just start to kind of be more creative yourself and think, okay, how can I shake this up a bit to help my child try something different?
Yeah.
And that made me think of something else, is involving the child in it. So even if it's like letting them cut something up or letting them put it on the plate or helping bake something, like that involvement sometimes gets some more buy-in from the child to then try it and want to be more involved in it.
Right. I've seen some things too, like you kind of build like a little Lincoln log house with the carrots.
Yeah.
Or let them do it.
Right.
Even though we don't want to encourage playing with food, but
steps.
have that exposure. Yes, baby steps, and then maybe a few less carrots to go with. Or making it, into a pancake into a smiley face with bananas, so they have to touch the bananas to take them off, maybe.
Right. So, team, I think we all brought up some valid points that could be helpful to any parent or caregiver that's struggling with a kiddo that has some feeding difficulties. So what I want to say is thanks for everyone for tuning into this episode of CollabTalk. If you find it valuable, please don't forget to like, subscribe, and hit the bell so you never miss an episode. Got thoughts or questions? Drop them in the comments. We'd love to hear from you. Until next time, let's keep this conversation going. To learn more about Collaborative ABA Services, check us out at collaborativaabaservices.com and our additional social media pages on Instagram, Facebook, LinkedIn, and what's the other
TikTok.
one? Oh, yeah. TikTok. Bye.
Bye.
CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.